Good morning, everyone. My name is David Morrow, and today I'm going to do an analysis of a case study regarding APUS Medical Center and a employee by the name of Samantha Lee, who was a pediatric nurse. Just to give a little background of myself, this is for one of my classes to achieve my MHA. I also already have my MBA, and I've been working in healthcare for about 12 years at this time. And this is more or less to expand my knowledge about leadership in healthcare. So when we're talking about the APUS Medical Center, a young nurse by the name of Samantha Lee was a pediatric nurse and known for her compassionate care and strong rapport with families. She was very, very active on social media and posts frequently about her life experiences, things of that nature, even at work. But she did not contain any PII in that information, so she always kept it very, very strict about her experience and what she had to do, nothing about the patient themselves. According to the case analysis, what happened was that on a Friday, the hospital hosted a celebration for their newly opened pediatric oncology wing, and although the party itself was very modest because of the budget, it was still a festive event, but to Samantha Lee's standards, it was not up to par, considering the fact that they had just spent so much money on the wing. And she had posted this on social media as part of her experiences, showing that APUS Medical Center did all of this to celebrate our kids, but they didn't put much effort in the actual event, which it eventually went viral on social media, and then a patient's parent wind up complaining about it to the patient experience department, and that eventually got to the chief nursing officer, HR manager, and other people, other higher ups in the APUS Medical Center's leadership. And then what kind of was the backlash of what happened is that Samantha was kind of noted for seeing that her video was damaging to the actual facility. Now, if we're going to go in through this actual case study, Samantha herself is, like I said, a valued employee. She didn't necessarily violate anything specific with the facility. It's more of like the general code of conduct and professionalism expectations that she violated, which kind of emphasizes that you as a nurse should have more of an upstanding look towards the facility itself, considering that you are one of the people there that are taking care of people. And if you don't have trust in your own facility, then how do patients have trust in us and your personnel that work here every single day? Although her particular post was not truly damaging to the facility, HR itself has to kind of think of the risks that are involved. Now, when you look at the American Nurses Association Code of Ethics, it emphasizes that nurses are supposed to uphold integrity and profession to avoid actions that could undermine the public and healthcare institutions. This is very, very important because, again, if we as patients are coming in to see nurses and providers in particular facilities, and they don't even believe in their own facility themselves, I don't know that I, as a patient, can trust you as a provider, because you don't even believe in what you do here, and it's kind of your health on the line. But APUS, they kind of let themselves open for some kind of risk, because when you think of it from an HR standpoint, they did not have a social media policy. They just had a general code of conduct and professionalism expectations. So the legal exposure to that was minimal, because they didn't violate any. Samantha Lee didn't violate any HIPAA laws. She didn't violate really any laws, honestly. But the ethical question is now her aspect to the hospital as a provider for the patients. When you're thinking about ethical reasoning behind what happened, you're thinking about this particular person, are they going to uphold the highest standards in this facility, although there may be some areas where there could be room for growth. But you as a person should always maintain that integrity that you are going to uphold as high standards. Me as a military member, I'm also in the Navy. They tell us to uphold the highest standards, and I do that every single day, whether I like it or not, whether I think what we're doing is completely stupid or not. I still keep my opinions to myself and do what I'm told because I know for a fact that I know people are depending on me to keep our country safe. So that's where you as a nurse have to kind of keep that aspect in mind. We have to think about the reputational risk. This is a video that went viral. People are going to start looking at it and wondering if I should even go there anymore because they don't care about the celebratory nature of opening a facility. They don't want to spend extra money on things, which honestly I agree with them. If the budget is low, don't spend all the extra money. But I don't, I'm not the leadership per se. But I agree that they're going to have some perceptions from patients that it's a viral criticism that is spread by one of their personnel that is going to be very damning. But the one thing that they should have looked into is that APUS Medical Center, within this age of technology, should have really looked into some kind of social media policy. In the year of 2025, they should look into some kind of social media policy. This is very, very important because everybody has phones everywhere. The world is changing into having your phone on you all the time, and they need to have clear directions, guidelines, and policies regarding social media in the workplace. Some places do it. I've worked at facilities that had that no social media whatsoever, no phones whatsoever, unless it's for patient care. Then you had some facilities that were like, we're okay if you post something as long as it doesn't do anything damning to the facility. And even in the military, they have that now, that we as military members cannot put anything on social media that is damning to the military, and we have to put on our specific videos, clips, TikToks, whatever, that we are DoD personnel, but this does not represent the DoD. So all in all, I would say that the steps that they took to kind of maintain that organizational integrity was kind of lacking, because in the sense that you didn't have the things that were necessary for you to be able to reprimand this personnel on what she did or did not do correctly. Although yes, her social media post was very damning to the facility in some aspects, it's still the fact that you need to offer that kind of guidance to her to let her know, hey, this is what you should not do. You should not be posting anything damning about the facility. You're allowed and entitled to have your own opinions outside of the facility, but you cannot do that while you are in the facility actively taking pictures of different things that we are doing here. This kind of brings that idea of a specific culture to the facility to let people know that it's about positive engagement with patients, but also positive engagement with employees, to let them know that we are okay with you being on social media as long as it doesn't break any particular laws. But we want to still kind of keep that guideline of the legal reputation and the ethical aspects of it without damning everything that we've worked hard for, because a lot of people put a lot of time into building up that medical center, and with one video you could have shot it all down. So it's very, very credible to understand that with the Society of Human Resource Management, they have a way, pretty much a guide on how to develop a social media policy, and it helps HR managers and leadership in itself to understand how to direct personnel on how to create a social media policy that's tailored towards what their facility needs and their own missions. Like again, I said, we are in an age of a lot of technology, and it's just growing and growing. People use phones for everything, even medical records in some aspects, and it's been just a growing thing. But that nurse herself needs to have kind of clear guidelines as to what to understand, that how ethics plays a big part in what she's trying to do with bringing her social media to work. And again, she can have her own opinion about what's going on about her facility that she's working at, but she should not be providing anything that's damning to the facility. Otherwise, it becomes an issue of you really don't really want to be here, or you really don't want to be a nurse, and then that brings that trickle effect to patients around them that are like, I don't know if I want to be here. But all in all, this is my take on the actual case itself. and I'll be posting information about the references that I use to be able to kind of balance out what my analysis was with this video. Thank you so much. Have a wonderful day.